Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging and care plan. Our topic for today is women's heart disease. With me in the studio is Debbie Whitnable. Debbie is a registered nurse, and she is the manager of the Cardiopulmonary Rehabilitation Center for Wuesthoff Health Systems. And that seems like a long title, Debbie.
Yeah, it's a long title. Actually, what I do is I see the patients prior to an event, as being an open heart or a heart attack, and then after they have their event, continuum of care, we bring them in and we teach them lifestyle modification, modify their risk, teach them an exercise program, how to eat healthy, and deal with the emotional aspects of the disease process as well.
I think what was interesting, even before we go into our topic, even before I say what is heart disease, I want to talk just for a second about where you got your education and how you got started up at Wuesthoff, because I think it's an interesting thing, and it shows a lot about what a community college can offer.
Well, actually, I went to BCC,
right,
and I got my degree in nursing, and at the time, there was a great demand for nurses, and my interest and passion was cardiac. I started off actually at Holmes, and I was there for a couple of years on the open heart step-down unit. In 1991, I was called by Wuesthoff Hospital because they knew I had open heart experience, and they called to ask me if I could come and help start their program. So in 1991, I was actually on maternity leave. I came to Wuesthoff to help them open their step-down unit for their open heart program, and I've been there ever since. I worked the open heart unit, the step-down unit. I took care of the first angioplasty, balloon angioplasty at Wuesthoff, and then went into, when my children were getting a little, younger and needed more attention at home, decided to go to cardiac rehab because of the hours.
It's interesting, and I think viewers also, it's the reason I asked Debbie to tell you a little bit about her background, it was I think that too many people don't understand what our community colleges do for our community. And I think that shows a lot, reflects a lot, both on BCC, but also on your ability, Debbie, to go to a place and you made a comment to me that you don't have a resume. And I think the fact that a hospital that has one of the best open heart units around has thought enough of you to keep you in charge of their rehabilitation center, because I'm also an open heart patient, and I had a dissecting ascending and descending aorta all the way down into my stomach, and they sewed and glued me up as best they could, and so I've been there. I've been packed in ice for 12 hours while they operated on me. I've been 16 days in the hospital recuperating from that, so I'm very much aware of the importance of what we talk about today. But let's just start out with, and I like the fact that you are a registered nurse, that you do all this, so I think that what you can bring to the subject of women's heart disease is extremely important for our viewers, because I think women need to be more aware of the dangers of heart disease, and I don't think they are.
Awareness is the key to prevention.
Yes. Yeah. What is heart disease?
Well, there are several types of heart disease, and today we're going to be talking about coronary artery disease, or atherosclerotic disease. And what coronary artery disease is the buildup of plaque that happens in the arteries that feed the heart. The heart itself is the size of the fist, and it sits in the center of the chest, and it's fed by 3 major arteries. Over time, these arteries can become blocked with what we call cholesterol and fatty substances, or plaque. So if these arteries become blocked, they cannot get the heart cannot get the adequate blood flow that it needs. And that's what coronary artery disease is.
Okay, I think in part of our discussion at one point we're going to talk about plaque and diet and everything else, but I think this is a good point right now to, so many people talk about good cholesterol and bad cholesterol. What do you really mean by that?
Okay. Years ago, we thought that cholesterol was a culprit in our diet that led to the buildup of plaque. And over the years, we've looked at it further, and we now know that cholesterol is a part of the buildup of plaque, but we also we broke it down to HDL and LDL. H, we say, stands for happy, that's the good cholesterol. L stands for lousy, and that's the bad cholesterol.
I never heard that one before.
That's a very easy way to remember it. H for happy, L for lousy. So when we look at cholesterol, cholesterol is something that comes from any animal product. Any animal product has cholesterol. Chicken lays an egg has cholesterol. Cow gives you a steak, gives you milk, they have cholesterol. Pig gives you pork, has cholesterol. Any animal product has cholesterol. It's broken down when we do cholesterol levels into HDL and LDL. Now you want your cholesterol levels to be total cholesterol under 200. You want your happy cholesterol, the optimal number would be above 60, and your lousy cholesterol to be under 100. So a lot of times when you go to the doctor, he draws a cholesterol level and he says, oh, your cholesterol is okay, it's 199. But you have to be your own advocate, and you have to say, but I want to know what my good cholesterol is and my bad cholesterol, because that's very important.
Folks, I told Debbie, really, when I had not met her before today's show, and I said, from working on a rehabilitation, you think of I'm not going to say a big person, that can handle patients and move them around. Yet Debbie walks in here, and she's a very petite person, and then when I hear her talk about cholesterol and eating good foods, you're not going to tell me you don't eat anything. Are you a vegetarian?
I am not a vegetarian, but I do believe that it's the way we eat is learned behavior. And
how do you eat then?
Well, when I was growing up years ago, just like everybody else, we were told you cannot leave the table until your plate is empty.
Right.
There's starving people in China, and I would remember trying to feed the dog, pay my brother $1, whatever I could to get off from the table. And I've been doing this for 25 years, and I've learned at a very young age what a healthy diet was. I watch portions. I eat no fried foods. We don't have salt. We don't salt anything. I can honestly tell you, and everybody gets a big kick out of this, I have a 17-year-old son. He has never tasted a hot dog, ever. Because I don't buy them, and I've never fed my children hot dogs. So the way I eat is a very easy way. Keep your plate colorful, and when you're shopping, you go around the outside of the grocery store, meaning fresh fruits and vegetables, yogurts, your fresh lean meats. Be careful of your box foods, your canned foods, your frozen foods. Now, the one thing with that is it can be a little bit more expensive, but you can go to like the produce markets and get your fresh fruits and vegetables. And if you eat more fresh fruits and vegetables than you do meats or your carbs and your potatoes, you're going to get a healthier meal.
Do you know Dr. Sheldon from Solid Bite Dental Implants?
No, I do not.
He's the guy on the commercials in the pink scrubs. You've seen him?
I've seen it.
You have to watch. You got to watch TV more. Anyway, you and Dr. Sheldon would just go like a hand in a glove together because he believes the same way you do. He believes that, he almost believes anything that comes out of a box you should stay away from. But my wife and I think the same way. But when you tell the story about the hot dog, my grandfather would not eat a hot dog either. But the reason he wouldn't eat the hot dog is because he'd worked in a meat plant before,
right.
and so he wouldn't eat the hot dogs at all.
Right.
But, heart disease is something that I think that the American people need to be better educated on what is good and what's bad. Why is it that I'm sure heart disease, it's probably the number one killer throughout the world.
It is the number one killer in the United States. It is predicted in 2020 it will be the number one killer in the world. And heart disease is not age specific and it is not gender specific. 1 in 3 men suffer from some type of heart disease, as well as 1 in 3 women suffer from some form of heart disease.
Would you say that again? Because I want our viewers to understand, because that's a question I was going to ask you. What is the difference in heart disease for men and women, or is there a difference?
Heart disease is the number one killer in the United States. Not age specific, meaning it can affect anybody at any age. My youngest patient that I took care of was an 18-year-old male, and my oldest, of course, would be in the 90s. It is not gender specific, meaning it does not affect men more than women. What happens is women have different symptoms. What we read in a textbook, the classic symptoms of a heart attack would be crushing chest pain. I felt like an elephant was sitting on my chest, radiating down to my left arm, profuse sweating. Those are textbook pictures. We don't see a lot of that. We see vague symptoms. It could be jaw pain. It could be shoulder pain, upper back pain. For women, I see a lot of fatigue, shortness of breath. I had a 44-year-old woman that I did a talk on women and heart disease, and she was listening to me, and she said something clicked. She said, you know, I was out shopping at the mall with my mother the other day, and my mother outshopped me. I had to sit down and rest. She wound up going and getting a physical. She had heart disease and had coronary artery bypass surgery.
Why is it that we don't do a better job, Debbie, of promoting the dangers of heart disease for women?
We at Wuesthoff are affiliated with the American Heart Association, and I am a Go Red speaker. February is Heart Month, and every February I do a lot of community talks about women and heart disease. The big difference with women is they don't seek medical attention as fast as men do because our symptoms are vague. We may say, oh, this is indigestion. Oh, maybe this is a little bit of arthritis. We don't have the textbook symptoms. So it takes us longer to seek medical attention. And then when we do, we're at risk for having more damage than a man does.
I've interviewed several heart specialists over the years, and a general consensus is that if we get to an emergency room within an hour of the onset of a, if you want to say a classic symptom, or if you really think you're having a heart attack, or if you, we'll get into this, but if you get there within an hour, you got a pretty good chance of making it.
The rationale for that is time is muscle. When we talked about coronary artery disease and we said that it's the buildup of plaque, over time what can happen is you can have a heart attack. And that is where the plaque either builds to where the vessel goes like this and it shuts off the blood supply, or maybe a piece is dislodged like a clot and it shuts off the blood supply to that particular part of the heart and the muscle doesn't get enough blood and oxygen. So if you get to the emergency room quick enough, time is muscle. If you're diagnosed nowadays we are so, the technology and is there where we're actually doing EKGs in the field, EMS, getting an EKG, calling in and saying, hey, I think I'm having someone with acute. Another word for heart attack is myocardial infarction. Right. They bring him into the hospital. They go right up into the cath lab. Cardiac catheterization's done. They go into the groin. They're looking, or into the arm.
That's a new one, isn't it? Going through the arm.
Yes, it's not real new, but not all the doctors use that.
Yes.
So they go in and they look. If there's a blockage, they can open it up with a balloon, put a stent in, and revascularize the heart, get the blood flowing back to the heart, so that we do save muscle damage.
From the time a person comes into your hospital emergency room till they can do that kind of procedure, is there an average time? How long does it take them to do that?
Well, we at Wuesthoff, and to be honest, I can't give you, we are way under national average. So we're way under 90 minutes. We have a great team. They're there, they're ready in the cath lab to bring you in and do that intervention. And we have amazing results with that.
Are they manned 24/7 to do that?
Yes, we are. Yes, we are.
Do all the hospitals do that?
No, not all the hospitals do that. We at Wuesthoff are one of the very few hospitals in Brevard County that offer services from birth to death, meaning we have family birth on up through pediatrics, and then we have adolescent care, cardiac care, geriatric care. We also, if you do, have a heart attack, we have the cath lab available. If you say, for example, that there's a heart cath done and you're not a candidate for a stent or angioplasty and you need open heart, we have open heart. Then we have the services that you can go. We have a progressive care center if someone needs an additional little bit of help. We have hospice, and then we have outpatient services such as rehab, physical therapy. So we encompass all the services from birth to death.
And just so that I want our viewers to know that one of the shows we will do deals with rehabilitation. Another show will deal with the hospice unit. Another show will deal with men's heart disease and prostate cancer. So what you're saying is that continuum of care is everything is there. But it's sort of in the back of my mind, didn't Wuesthoff get a Healthy Heart Award or something 2 years or 3 years ago?
We did.
It
started years ago. It's called Get With the Guidelines, and we were one of the first in the county to be certified for getting to the guideline, where we met all the indicators by American Heart in treating the cardiac patient, not only in heart disease, but in stroke. And we have sustained that certification. We are now doing a chest pain accreditation team. That's our next goal. So that's something that we are working on now.
Are you qualified to speak about stroke or not?
My background is more cardiac. I mean, basic stroke.
Well, what I was probably referring to, we've talked about the necessity to get to the hospital quickly from a heart attack, but the same kind of a standard exists for stroke.
Absolutely. We have what we call stroke alerts. And so as soon as we know someone's coming in that is a possible stroke, we are there and intervening.
Is it a stroke unit or are you the same unit that does it?
Well, it's a stroke team's different.
You have a stroke team 24/7 also?
Yes, we do. Mm-hmm.
That's amazing. By the time we finish this series, we will have done over 300 television shows, and almost every television show we do, a different aspect of healthcare comes up, a different aspect of what is available in this community, and I think by having these types of shows that if we get them out to more people across our state, more people will see what is happening in one of our communities and might awaken them to say, we want to do some of those things where we live.
Absolutely.
I see, as a manager of the rehab unit, and we didn't even discuss this in our questions, but how important or what importance do you attach to rehabilitation after a heart attack?
Well, just to go back a step, it's very important that you know your risk factors. So all of us sitting in this room, as I tell you quickly about risk factors, you should be thinking about, are you at risk for heart disease? And the risk factors are smoking, and if you smoke, the option is just to quit.
I quit a long time ago.
High cholesterol, diabetes, high blood pressure. And those three, the big misconception with people is, okay, I have high blood pressure. Well, I may have high blood pressure, but I'm on a medication, so it's not high anymore. That is a huge misconception, because just because you're on a medication for high cholesterol, high blood pressure, diabetes, they are not curable. They are controllable. So if you're on a medication, you still have to do all of the other things. You still have to eat properly. You have to exercise. You have to take your medications.
I take 2 blood pressure medications. I take Adalat and lisinopril.
Lisinopril.
My blood pressure is generally around 110/79 or 80, even sometimes a little bit lower. I think at times of stress or something, it might go up a little bit higher.
And that's normal.
But I exercise daily. We do eat, my wife does eat a lot of fresh foods. We sinned a week ago. We were coming from someplace, we both love fried fish. So we stopped at Long John Silver's. And that's going to be my fried fish feast for a long time. Because, like you say, there is a lot of grease. And I ate it, I enjoyed it, but I knew it was not good for me. And when I have my shows with Dr. Sheldon, I always say, well, we can do things in moderation. He hates that word. He believes that once you set a program, you should stick to it. But what should I could be concerned about? Am I doing the right thing with?
Absolutely.
Okay.
But there are things like family history that you don't have a lot of control over. If you have a family history, if you have the gene, you have the gene.
You can have a genetic problem.
You can have a genetic problem. However, again, you need to look at your risk factors. Okay, like obesity. If you're overweight, then you need to lose weight. You don't look to me like you're overweight. Physical activity. Physical activity doesn't mean, going out and doing the grocery shopping. It means taking a half-hour time for yourself, walking, swimming, doing some aerobic type of exercise, eating healthy, not skipping meals, taking your medication as prescribed. It has to get to be like getting up in the morning, washing your face and brushing your teeth. If you get up in the morning and you forget to wash your face and brush your teeth, you feel like crap all day, right? And that's what your routine needs to be. You need to get up, wash your face, brush your teeth, and then eat your breakfast, eat healthy, do your exercise, and live your life in a healthy way in order to prevent another event.
You work in a heart unit. I happen to like to eat 2 meals a day. Is that good or bad?
That's not healthy.
Not healthy?
You need to eat 3 meals a day.
You need to eat 3 meals a day. Okay, so I'll admit it on television. So my wife, she does. We always have breakfast. And if I'm at home, she always brings me a sandwich or always does something when I'm working my computer during lunchtime, and we always have an extremely healthy supper. It's always generally fresh vegetables and meat. And we don't eat a lot of ice cream. We eat those fudgesicles on a stick. But they're very, very refreshing. And we have one of them after supper or something like that. We don't drink coffee at night. We generally we have our coffee during the morning. So I think what we're doing is, I would say that if 95% of the American people try to do what my wife and I do, we would probably have a lesser rate of heart disease.
I agree. It's very difficult to come out and tell someone, okay, you smoke, you need to quit smoking. You're overweight, you need to lose 30 pounds. You need to drink 6 glasses of water a day and get rid of all the sugars. You need to eat 5 fruits and vegetables a day. That's kind of overwhelming. So when you're dealing with someone that you're looking at risk factor modification, we talk to them about baby steps. Take one risk, modify it, and go to the next. And I think that you'll have a better outcome than just saying, this is what you need to do all at once. I think that's very overwhelming.
I don't drink enough water, but there's something you just said that keys me to the fact, once I put something on a camera, I'll do it. And my wife will see this show. So I'm going to commit on this show to drinking more water, because I never really thought about the water washing the sugars out of the body. And I'm a firm believer, after talking with Dr. Sheldon so much, that sugars are really not good.
They're not.
And we don't realize how much sugar is in all the foods that we eat.
Absolutely. And water too, just hydrating yourself, keeping hydrated, flushing out the kidneys. It's very, very important. If someone is going to give up anything and they're drinking a lot of sodas, give up those sodas and go to water. Put lemon in it if you don't like water, but water is extremely important.
Now I'm going to say something as a joke, and I want people to take it as a joke. I could probably put a little Jack Daniels in my water, but it doesn't taste as good as it does in ginger ale. But there's a lot, care of the heart. If you can enjoy what you're doing and say, I like doing this, I know I'm going to have a healthier heart, I'm going to have a healthier body if I do this, it makes the things you're trying to do, I think, a little more enjoyable.
Absolutely.
Heart disease and prevention sometimes is a mindset. It really is. And we've talked about cholesterol, good and bad. We talked about, did we really hit enough on the aspect of the effect of blood pressure on?
Blood pressure is what we call the silent killer. Around 55 million people have blood pressure problems, and they're not even aware because there's not a whole lot of symptoms with blood pressure. If someone goes into the doctor and their blood pressure is 140/90, you're not going to be diagnosed that day with high blood pressure because a lot of people have white coat syndrome. So they may ask you take it over a period of time. If it stays high, yes, we're going to put you on a blood pressure medication. The culprit in our diet that increases blood pressure is sodium. So the easiest thing is to take the salt shaker off, exercise, take medication, just like it is with diabetes and high cholesterol. The optimal blood pressure is 120/80. That's where we want your blood pressure, and those are American heart standards.
But mine is under that, but it's mostly because of
because it's being controlled with the medication, diet, and exercise.
And that has to be done because of the fact that I had the aorta repair. So by taking blood thinners and keeping my cholesterol down and by keeping my blood pressure down, it doesn't cause my heart to work as hard.
Right.
So this is all part of understanding. What else would you want to say to women and men about heart disease, Debbie?
I would say give yourself a gift. Get your yearly checkups. Make sure that you're your own advocate. If you have risk factors that I talk about, let your doctor know. I have these risk factors. Do I need to be looked at for heart disease? And just be your own advocate. And just awareness, again, is prevention. Learn as much as you can. And, just understand that you have to be your own advocate and in the order to prevent.
And I want to compliment Wuesthoff Hospital on the type of program they have there. I think that I myself have learned a lot today, Debbie, about the importance of a healthy heart. I was looking, I had some questions here, and I was just looking to see if there's anything that I missed.
I'd like to share a quick story with you.
Okay, good. We got about 40, 50 seconds.
Okay, very young gentleman under his 50s came into the hospital with chest pain. While he was waiting, he was still smoking outside. Wound up having a heart attack. 4 months after his open heart surgery, he ran a 5K. And as we speak, today, he is still running 5Ks every weekend.
That's a good story. And thank you, Debbie.
Yep.
Thank you for watching. And you, viewer, thank you for watching today's episode of Focus on Seniors. If you have questions or comments, please call radio station WMEL 1300 at 321-631-1300. And for more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. And thank you for watching today's show. I hope you have learned something about a very important part of our health system. Thank you.